Hey, welcome to Whitecoat Medicine. This is Dr. David Cruz.
Dr. Carlos Olmedo.
And we're medical doctors here in South Texas, and today we want to talk to you about diabetes.
One of the most common problems that I think you and I probably will ever see.
We see tons of that, and that's one of the important things that we want to bring out, that our experience in seeing these patients, we're going to try to educate you all so that you can understand the diseases better, and we can actually inform our patients better. A lot of times patients come to our offices and they forget to ask a few questions, they forget what we say, and this is what we're here for today.
Yeah, I think probably the biggest thing is us telling them, hey, you're a diabetic, and we're just saying that, and they're probably like, for a few minutes, I think some of them are just in shock.
Yes.
Right?
And because of the shock, they don't know what we say after that.
Yeah.
And it's all forgotten.
Can I talk to you again about diabetes? I mean, literally, I think they just heard.
Exactly. The second visit, maybe you get more information out, but I think for now, let's discuss what is diabetes.
Well, there's two types of diabetes. There's a type 1 and there's a type 2. The type 1 is dependent on, usually occurs with younger patients, on insulin, where it's just not working, or the cells that your body has, because we're made of cells, and it's just not functioning the way it's supposed to, so they're needing exogenous insulin.
Right. So you have these patients that now come in and you're telling them your sugar has been high, it may have been high for some time now.
Yeah.
And so we want to be able to treat them. And yes, you have type 1 and type 2. Now most of the people are going to have type 2 diabetes. It's very, very common. Maybe 95% of the people will have type 2 diabetes. And so we may focus more on that as time goes on, because there's medications for that, and there's more treatments for it. Now for type 1, what would you tell a type 1 diabetic?
Well, you know, I was just thinking about the types 1s that I've had in the past, and most of them have gone through lots of, crazy, stories with them ending up in the air. They don't know why they feel bad, and all of a sudden, they're, feeling bad, so they end up getting diagnosed with diabetes, and so they're all of a sudden they're using insulin, and so they got to get used to that, a very strict diet, in a less sugar, and they have to understand and be educated. I always see them rebel, these poor young kids that get diagnosed, as they get older, they maybe understand it better, but at the beginning they rebel in following, what they're supposed to do.
So type 1 diabetes, we definitely want to make sure that you understand that insulin is very, very important. Your body cannot function without the insulin. It cannot control where your sugar goes without the insulin, so it's going to stay in your bloodstream and cause all the damages that diabetes does happen to cause.
Exactly.
So then now we have the more common one, type 2 diabetes, and what is your experience with that?
The type 2, it's crazy that we see so many people that with a little change of their lifestyle, such as maybe I should eat better,
right,
maybe I should move a little bit more, I may just not have to take medicine. And that's what I tell some of my patients, is the goal here is to try to get you off medication.
Right. Sometimes before even starting medication.
Exactly.
And Carlos is absolutely right. We need to make sure that we are treating our patients with diet and exercise. And so your doctor is actually going to tell you, you need to take care of yourself. You need to exercise, possibly say 30 minutes a day. It can be walking, it can be any type of exercise, as long as you're doing something. And then the diet has to be controlled. Patients are afraid they're going to have to drop all their foods and everything, but it's really just modification and knowing how to eat. Some of those topics which we will cover in other videos later on.
Exactly, and I think that's many things that go along with your diabetes. I mean, there's other meds that a diabetic should be on that I think is important. Um, and I think, you know, if they are diabetic, we want to make sure that they end up with aspirin or a statin, which I think would be also important.
Very important. So your doctor may initially put you on a aspirin a day, and you'll maybe question why. And it's because of the circulation, and we want to try to prevent strokes and heart attacks, and that's one way that we use to treat you for those things. And in addition, they'll put you on a statin, which are medications to decrease your cholesterol. And what we want to do with that is also decrease the chances of you getting any atherosclerotic disease in your arteries, keep them as clean as possible, take care of your brain, make sure you don't get heart attacks, all those things. And that's why the doctor is going to put you on these medications.
Yeah, it's unbelievable the amount of problems that sugar can do. You know, I literally tell my patients, you know, if one can of a drink can obviously affect you more than maybe eating a little cheeseburger, because that sugar does so much damage, you know, such as
Right.
your eyesight, you know.
Yeah.
I think you touched on it, Dr. David, about the brain. There are so many other things there that it affects, circulation and so forth. But and as we move along our videos through diabetes, we'll be detailing a little bit more.
Correct.
Some of these side effects.
One of the things that patients do come in and they want to stay off medication.
Exactly.
Because they've never been on medications and they don't want to start medications. But what about that one patient that you see that you know has to be on medication? What do you tell them?
You know, it's a very good question. They got those that you tell them they have something like diabetes, and they will start walking the next morning, go and sit down with their wife and discuss what they have to do, get on a video, YouTube or somewhere, information of how to deal with diabetes. But yeah, that one patient that doesn't change, their habits are, you know, are not good. It's one of those that you bring almost every month for a while,
Yeah.
and just, you know, try to stress the importance of diet, the importance of exercise, and the importance of taking your medicine, you know, to control it. And if these patients don't really work hard at trying to get off these meds, well then the best we can do is control them and control their diseases.
Correct.
And so it's very, very frustrating sometimes, you know.
Right.
I think I've, you know, try to find a way of making them take care of their bodies, you know, like a car, you know.
Right. They got to take care of themselves. For
That
sure.
machine, yes, the most important machine. So I don't know your experience with patients.
Yeah, very much the same. You deal with the patients as they come along. Everybody's different, and we
Correct.
understand that all of you are different. And when you talk to your doctor, you may have a different response from every single doctor when they talk to you. We do try to explain the importance of the medication and why we give medications. Sometimes it's not always understood by the patient, but we try to make sure that they can kind of understand more or less why they're taking their medications, and as the visits go along, explain it better.
Yeah, it's
Yeah.
that education, and over and over. I think that repetition.
It's ongoing.
It's ongoing.
Yeah, as these videos will be. And Carlos, I think what we're going to stress on the following videos are going to be medications. Then we'll hit the different things that diabetes will affect your body as well. And we will keep on trying to explain everything to you guys as well as we can, so that you can have an easier way and a fast way of looking up information for these things.
Exactly. Looking forward to talking to you on the next video.
Very good.